computer. Hey, Facebook friends. Thanks for joining us today. We're so excited to have you here. My name is Melissa Crispell. I'm your host of the PIH Live show. Today, as you can see, I have a special guest with me. Dr. McGuckin is back. Thanks for being here, Dr. McGuckin.
I'm happy to be here.
Awesome. All right, everybody, as you're coming in, do me a favor, like this show and share the show so that we can get this message out to as many people as possible. We're going to dive right in. Today, we're talking about Repair Guard. Repair Guard is PERQUE's anti-inflammatory type product. It does exactly what it says. It repairs at the cellular level. So, Dr. McGuckin, we know that PERQUE Repair Guard is your solution for managing inflammation or repair deficits, as Dr. Jaffe likes to call it, because it stimulates repair naturally. Can you talk to us about why you like this product?
It's the most effective of it's PERQUE's. It has to do with the way PERQUE manufactures and their quality control on the quercetin dihydride. It is the most effective of the flavonoids and flavanols. We've tried other products. We've tried different things. We do not get the same results. We need 100% effectiveness. The 30–50% isn't going to work. We've tried some of the turmeric type products, and some people really can absorb it and they get some benefit. But when you're talking only 30%, maybe 50% at most, there's a lot of disgruntled people. We tried other brands of quercetin and we had to quadruple the volume of product taken, and no one's happy there either. So definitely the Repair Guard's the best of any of the products out there.
What about, a non-steroidal anti-inflammatory, something like ibuprofen or Advil or something like that? How do you think Repair Guard plays up against those guys?
Any of the pain medications are effective. They take about 45 minutes to 45 minutes to kick in, and they're good for as long as that pill's going to last in you, an hour, 2 hours, and then you're back to taking it. There's no repair. The Repair Guard does stimulate the repair cycles. So we tell patients it's a knitter. Anybody who's going in for surgery, anybody who has an injury, we immediately get them on Repair Guard as quickly as we can, as soon as they get home, because the pain relief is progressing. So if I take 2 Repair Guards and I will get some pain relief. When those things are out of my system, I don't go backwards in pain. I actually keep advancing. So we'll have people take 2 Repair Guards every hour, take 2 Repair Guards every hour. You can read common sense reduction as the pain drifts, but the pain stays away because they actually healed. Yeah.
What about some of the other products like Vioxx and Bextra and Celebrex and some of those other COX-2 inhibitors? How does Repair Guard compete with those guys?
Well, the Repair Guard's actually speeding the recovery so quickly that it's a downregulator on the COX-2 all by itself. It's a naturally occurring downregulation on the COX-2. And we're doing this without the risk of heart attack or a stroke. That we eliminated those risks because this is a natural product. So one pill isn't going to work. You're going to have to take several of them, and it does take a day for this to build up. But once it starts to build up in a person's body, it works much better.
Yeah, and that's what I like about the Repair Guard is, full disclosure, like you just said, it's not going to be one pill. It's not a one-for-one kind of replacement for those other items that people might be using, for pain management or, headaches or menstrual cramps, whatever. But the Repair Guard works better because it is promoting and stimulating repair within the cell without any of the side effects. You just mentioned it, without the side effects of stroke or heart attack or, ringing in the ears or constipation or dizziness or, we've all seen the commercials on TV. Take this and just so you know.
Right.
Yeah.
Right.
Exactly. So I would have to say the one thing that I've noticed about Repair Guard is that I can't take too many at one time. There is a little bit of magnesium in there. So,
Well, what we've also noticed is it's an absorption issue. And there's a little bit of common sense with We just from experimenting on myself and with patients, we found that two pills together gave the maximum benefit compared to 3, taking 4, taking 6 all at once. You can only absorb so much at a time. So spreading it out was the most effective and cost-conscious use.
Yeah, absolutely. And I think what people just may not be aware of is that when you're taking those other meds, that they're blocking the pain. That's all they're doing is blocking the pain. They're not getting to the solution, which is what Repair Guard is doing. It's getting to the cells, getting to the solution so that the system can repair and restore, its optimal function. All right, let's dig into the ingredients. We know that the main ingredient of Repair Guard is quercetin dihydrate. There's 1,000 milligrams in the Repair. There's 500 milligrams in the Pain Guard. Quercetin is this yellowish, greenish flavonoid from the sacred Sephora japonica tree. It is, in its soluble, low molecular weight form, it helps to reduce the allergic and inflammation responses. Research has even shown that it is an antiviral, it's an antioxidant. What other ingredients are important to you in this product?
Well, first I want to go back to quercetin for just a second.
Yeah.
And for anybody who's not familiar with Repair Guard, hasn't used the PERQUE products, if you're just watching this, I would invite the challenge of buying other people's products and compare it and do a comparison. The PERQUE is demanding that their sources are giving them this stuff is ground down to a microscopic dot so that they have real absorption. You're just not going to get the effectiveness. Oh, I take quercetin. Well, and your problem didn't get better either. So there's a reason why it failed. It's the product, not the idea. But Repair Guard uses pomegranate juice. It's pro-repair. It's anti-inflammatory. It's free radical trapping. There's 10 milligrams of OPC flavonols. It provides cell stress protection, and it's a connective tissue restorator. I call it a knitter. I tell my patients it's knitting the torn muscles back together, or the injury or the inflammation in the body.
Yeah, I like that pomegranate juice. And that pomegranate juice it's been used for centuries. It's not brand spanking new, but it's the quality and the way it's all put together at PERQUE. PERQUE delivers novel, bioavailable systems. It's not just let's throw a product in a capsule and see what happens. Right,
exactly.
Yeah. What about OPCs, Dr. McGuckin?
The orthoproanthocyanidins. The Repair Guard OPC is absorbed into cell membranes, protecting them against fat and water-soluble free radicals. So it's a true anti-inflammatory product. They can cross the blood-brain barrier. They offer protection from oxidative stress and free radical damage. They also work with vitamin C and vitamin E. It's an enhancer, and that's why you see it in the Lifeguard.
Yeah. And hey, by the way, talking about vitamin C, because we both love vitamin C, Thursday, the 4th of April, is National Vitamin C Day. Did you know that?
Oh, wow. No, I did not.
I didn't either. One of the girls on the marketing team said that to me the other day, or last week when we had our meeting. She was like, and by the way, just so you know, on Thursday. So, hey, since we're here doing a PERQUE infomercial anyway,
right?
Repair Guard and the Potent C together is a power-packed combination.
Now the Repair Guard will also, it stabilizes the mast cell. So with airborne allergies, we're going into tree season now, asthma, it stabilizes the mast cells so they're not as reactive. There's a considerable reduction in inflammation because we're just not having all these inflammatory particles flying around. So it works very, very well. We use it with the LRA test. If we can, I think of it as a pyramid. If I can reduce the overall volume of allergies going on in a person, then the trees, grass isn't going to bother them so much. And then we can control it with the Repair Guard.
Nice, I like that. Let me ask you this. We're talking about restoring the body's ability to repair itself, and we're talking about, anti-inflammatory and such. What tests would you recommend that someone use? Because why guess when, we can test, right?
Yeah. You can measure inflammation in the body. Overall, is that just doing the allergy test, the lymphocyte response assay test, we can, you can see just how based on the patient's symptoms, but also based on the number of allergic items that come through on the test, how much inflammation does this person have in their body? The high sensitivity C-reactive protein will also give you an idea of the overall level of inflammation that this person's experiencing.
Yeah, and the awesome thing is those are on special this month at EAB, so you can save practitioners out there. If you don't have your account open yet, send us a private message. Let us get that account open for you, because when you order your patient's LRA by ELISA ACT test and tack on the HSCRP, let's look at what's going on inside the house. Is the house on fire? You know, that's what the CRP does, and you can save money on both of them.
And the Repair Guard, because they're throwing in the pomegranate juice with it, it covers this whole body inflammation. It's called a phenol-menal antioxidant. It's anti-inflammatory, it's bacteriostatic, it helps the prostate inflammation, cancer risk protection, it's anti-atherosclerotic. It's as you already mentioned, this product wasn't just thrown together. A lot of time was put into making this stuff work like it's supposed to. It increases natural killer cells. It really does boost your anti-cancer defenses. These are things that when people are going through their prevention, but on a daily basis, what we're after is prevention. But while someone is having treatments done, these things can help them with the aches and pains that come along with the treatment sometimes.
Yeah, absolutely.
It is anti-cancer properties. The quercetin does have anti-cancer properties.
Yeah. And the cool thing about using the LRA test as a first-line approach, you know, even before we're recommending supplements, you know, maybe someone gets pomegranate on their LRA by ELISA ACT test.
Yes.
That would mean that they would have to steer clear of Repair Guard because it does have pomegranate juice in it, but they do have Pain Guard.
Yeah.
You know, as a good alternative, because that doesn't have the pomegranate juice in it. So, you know, they'll have to take a little more, you know, have to take a few more pills because it's half the dose of the quercetin in each tabsule, and we call them tabsules for a reason, because they are pressed like a tablet. They're shaped like a tablet, but they're not pressed so hard like a traditional tablet. They are pressed just enough so that you can still, once they are, you know, once they're wet, they're in the digestive system, they will break down and absorb like a capsule does. So we have tabsules. So, you know, Pain Guard, you have to take a little more than the Repair Guard just because it has less quercetin in it, but it's no less effective. You know, it's equally as effective. And
the Pain Guards, for anyone that hasn't seen them, they're very, I'll say small. They're long and skinny. They're very, very easy to swallow, and for kids we just have them chew them.
Yeah,
bribery works.
Yeah, no, bribery always works with kids. Ice cream. No, we can't do that. Yeah, I personally prefer the Pain Guard just because of the size. There's no other reason. It's just the size, and you know, it's easier to, you know, pop a handful of those Tic Tac shaped ones than the football shaped ones.
I like the Repair Guards.
Do you? Yeah. Because it's stronger, or the size just doesn't.
The pomegranate juice does something for me. Gotcha. I can tell the difference. I know it sounds crazy, but there's less inflammation overall, more vitality with the pomegranate juice.
There you go. Well, that was the point of it. That's the point of it. Yeah. So, Dr. McGuckin, do you have any, you know, cases that you could share, or
I got lots.
story that you could share? I love hearing about these.
I have a blast with this stuff. No, people just don't understand. We were all raised the same. You know, take your pain pill, it's gonna hurt, and I just have the best time when somebody comes in and says, well, I'm gonna have my molars taken out, so I just can't wait to grab them and just say, well, as soon as you get home, start popping these things. And the dentists, the oral surgeons go crazy because my people just are done with it. They recover much, much faster than if you weren't taking it. So for any type of surgery, we use it as a recovery tool. We want you, if they say you're going to be back on your feet in 10 days, we want you back on your feet in 5 to 7 days. We want this fixed. Injuries. When the weekend warrior falls off the roof, we do have to get back to work on Monday. Yep. So I'm not going to tell you my stories, but I was back on work on Monday. No, I didn't fall off the roof, but it does speed the recovery quickly. We had a fella come in. He's got achy joints. I think he's a weightlifter. I think he just tore up his joints, and he's living on Advils. We switch him into the Repair Guards, and he's buying the 500-count bottles because he can take a small dose of this stuff, and he's 100% pain-free, and it's good for him. One surprising, and this is a fun one because people can get direct feedback from a third source. Anytime the dentist is telling you the pockets around your teeth are expanding, that you're receding gum lines, you can repair the basement membrane. You can get that basement membrane to re-glue down the gum. You can save them from tons of misery by just throwing in the Repair Guard. The older you get, then you got to throw in the Mito Guard as well. You do have to accelerate the recovery. Right. So keep that in mind. Any kind of retinal issues, retinal detachments, anything of that nature, we use the Repair Guards. We had somebody recently that, now we did not do a food allergy. We were not able to convince this person of the necessity of the LRA test for this particular individual. But this individual had tear duct closure. So they opened up the tear ducts, and it created an inflammatory cycle where the tear ducts stayed inflamed. And she's got these bloodshot eyes. She can't see so good. They're just a giant mess. The Repair Guard cleaned it up in about 2 weeks. It was just gone. And she was surprised that it had that strong of an anti-inflammatory property. But it's not anti-inflammatory in the sense of Advil. It's anti-inflammatory in the sense that there is repair. When she stops taking it, the repair is still there. She's taking a maintenance dose to protect the eyes, but the injury that was not recovering, whatever happened with the tear duct work, it was leaving her in a bigger problem, and now she's completely recovered. So we do have a real good time with this product. Great successes. Yeah,
that's awesome. Awesome news. And on the pain management front, I had one parent with a hip replacement and one parent with a back. It's almost a back replacement with as many screws as he had put in. And they both took that as well too. And their docs were like, how did you even recover this quickly?
Wow, that's fun.
Yeah, it was fun. Well, they give them sideways looks when those bottles are there, in the facility. But yeah, so they take it once they get home. So yeah, that's good stuff. It's a great product, and it can be used for, and you can confirm this and validate for our audience. This can be used for anything from headaches to menstrual cramps to seasonal allergies. When the body is not operating properly, there's a need for repair, and Repair Guard can fill that space for them.
I'm glad you said that. It reminded me, when we're putting together a person's nutritional program, the Potent C is free of bioflavonoids for a reason. There's no preservatives in there, and we want that pure white powder. If somebody leaves the cap open and moisture gets in there, it'll turn a brown as it's degrading. And so if PERQUE put the Repair Guard and mixed it in with the vitamin C, you wouldn't be able to see that it denatured. So it is separated. So with 1 teaspoon or 3 Potent C capsules, 1 Repair Guard is needed we need the bioflavonoid to make the vitamin C work. So it is part of everybody's daily routine to at least take 1 or 2 pain guards. So irregardless of who they are, there is some quercetin in the lifeguard. So on the smaller kids, people where the volume of pills is an issue, there is some quercetin, so I feel happy with that. But for the best use of vitamin C, we do want some extra quercetin, bioflavonoid.
Absolutely. And thank you for bringing that up, because I will be recording with Dr. Jaffe when I get back from California, and he is going to talk about that specifically, about why we're putting it together and what it does for the body. So Dr. Jaffe will be with everybody talking about that later this month too. So that's exciting.
Yeah, great.
All right. Any parting words, Dr. McGuckin, before we hang up?
No, we're doing good. But do try it. I would encourage people to experiment and try it, and not in the idea that it's a little miracle worker. It really is, and it's asking your patients to give it a try.
Yeah, absolutely. Thank you. Thank you so much for being here with us again today. I love doing these interviews with you. It's really fun.
Oh, great. Thank you. Thanks for having me.
All right. Thank you, Dr. McGuckin.